Hello, everyone. This is Dr. Peru here, a nutritionist by profession. Well, do you guys know, when I heard the statistic up to 80% of all women develop some type of fibroid by age 40, it was mind-blowing. Why is that? It's so strange. And the last thing that any woman wants is a hysterectomy with all the side effects, not to mention a fibroid. So I pulled a string and found something fascinating that I want to share with you about fibroid causes and associations. Let's first take a look at some clues about fibroids. 1. Fibroids decrease after menopause. That's interesting. Why would that be? Well, it's probably related to estrogen, and we're going to get into that. 2. When a woman goes through pregnancy or is exposed to HRT, hormone replacement therapy, or birth control pills, there can be an enlargement of the fibroid, which also seems related to estrogen. 3. There's a relationship between obesity, type 2 diabetes, high blood pressure, and polycystic ovarian syndrome, PCOS, all of which increase the risk of fibroids. 4. Why is it that Black women are 3 to 9 times more at risk for getting fibroids? Of course, the common theme here is estrogen. Estrogen is a growth hormone and a primary driver of fibroids and endometriosis. Let's look at what a fibroid is. A fibroid is tissue that grows from the uterus. What is the uterus? It's a muscle. The difference between the fibroid and the uterus is that a fibroid is a growth that develops from the uterus, growing out of the uterus tissue. A fibroid is non-elastic and contains a lot more collagen, which is why it's hard. There are some very interesting differences between a fibroid and the uterus. 1. A fibroid has a much greater sensitivity to estrogen, which means it can grow a lot faster than the actual uterus when exposed to estrogen. 2. A fibroid has more estrogen receptors. 3. There's more of an enzyme called aromatase in a fibroid. What's aromatase? It's an enzyme that converts androgens, which are more for men, into estrogen. 4. The environment inside a fibroid has a lot less oxygen than the uterus, creating a hypoxic environment. We'll come back to that. 5. Lastly, a fibroid has a lot more inflammation than the uterus. What do low vitamin D and fibroids have in common? There's one common thread that runs through all of these clues, and that is a low vitamin D situation. Now, regarding research in this area, which I'm going to cover in a little bit, there are mixed reviews on vitamin D. I think this has to do with the frequency and amount of vitamin D given to participants in certain studies. The amount of vitamin D needs to be much greater than the usual vitamin D that people are given, because most studies are operating off outdated information that suggests we need only small amounts of vitamin D, 600 to 800 IU. However, all that research is primarily for bone health and not for other systems like the immune system, the uterus, the prostate, the skin, the brain, or the muscles. These systems need a lot more vitamin D. Benefits of vitamin D. Inhibits the growth of fibroids. * vitamin D can help prevent the growth of fibroids. Regulates other growth factors. * vitamin D helps regulate other growth factors, which is crucial because fibroids are often out of control when it comes to growth. Aromatase inhibitor. * vitamin D also acts as an aromatase inhibitor, blocking that enzyme and preventing excess estrogen. Increases apoptosis. * vitamin D increases apoptosis, which causes the fibroid cells to undergo programmed cell death, preventing the growth of the fibroid. Anti-inflammatory properties. * vitamin D is one of the most potent anti-inflammatory substances, which is critical because inflammation can promote the growth of tumors or even cancer. Hypoxic environment. * vitamin D doesn't seem to work well in environments where there's not enough oxygen, hypoxic environments. A fibroid creates this low oxygen environment because it's so dense with irregular collagen and other factors, which could explain why normal amounts of vitamin D won't do much to affect the fibroid. Higher amounts of vitamin D are needed to penetrate and affect the fibroid. DAO regulates estrogen receptors. * There are 2 different receptors for estrogen, one that increases tumor growth and one called estrogen receptor beta that helps shrink the cells turning into a tumor. Vitamin D supports the estrogen receptor beta, helping to shrink the cells and inhibit the growth-promoting receptor. Lowers free estrogen * vitamin D helps increase a certain hormone in the liver that lowers the amount of free estrogen circulating in the body. Estrogen is the primary driver of fibroids, but without the brake pads that vitamin D provides, the system is out of control. The majority of the population is deficient in vitamin D, especially Black people and Black women. Why? Because the melanin in the skin blocks vitamin D. So here we have a population that is already low in vitamin D, and then they also have these spikes of estrogen, which means they will likely get more fibroids than people who have enough vitamin D. Now, let's take a look at obesity, for example. Obese people are often deficient in vitamin D because vitamin D gets diluted into the fat cells. So, an overweight person needs a lot more vitamin D because it becomes less effective as it gets stored in fat. As for type 2 diabetes, there's always low vitamin D, high blood pressure. I think the majority of that is due to low vitamin D, which is behind high blood pressure. If you give a person more vitamin D, their blood pressure goes down. Then there's polycystic ovarian syndrome, PCOS, which is a condition where there's too much insulin. This is very interesting because it provides a potential solution to a very common condition that affects up to 80% of all women. But I don't think you can make a significant dent in this problem unless you take enough vitamin D. I'll get into this in a moment, but first, I want to discuss a few studies and some anecdotal case studies that I want to share with you. Does vitamin D shrink fibroids? Well, research on this is a bit mixed, but I'll show you why. I'm not going to show you the positive results just yet. There was a study in 2013 in reproductive science that showed a significant decrease in the size of fibroids within 12 weeks when participants took 25,000 IU of vitamin D3 once a week. I believe if they had taken that amount every day, the results would have been even better. Another study in 2014 on African American women with low vitamin D levels found that a high percentage of women with fibroids had lower vitamin D levels than those who had higher levels. They gave these women 50,000 IU of vitamin D3 every 2 weeks, and after 10 weeks, they saw a significant decrease in fibroid size. I'm surprised they saw those results because taking it every 2 weeks isn't sufficient. You should take it every day. In another study by C. Vantini, women who took vitamin D saw no fibroid growth, whereas the group that didn't take vitamin D experienced a 40% increase in fibroid growth. Doctors even discourage women from taking 10,000, 20,000, or even 50,000 IU of vitamin D every day, claiming it's toxic. And the only toxicity that might occur is excess calcium in the blood, which can cause kidney stones. But you can greatly minimize that side effect by taking magnesium, vitamin K2, and drinking about 2 liters of water a day. These are all cofactors that help minimize toxicity. Personally, I think that if you're taking 50,000 IU or less, you're not even close to the range where toxicity could become an issue. There's also a great book that I recommend down below, which covers the use of high doses of vitamin D3. The author, Jeff B.S., has a website where you can read more anecdotal evidence in support of vitamin D. Here's one story. I had a large fibroid tumor, and the doctors recommended surgery to remove my entire uterus. After staying on a high dosage of vitamin D3 with proper K2, magnesium, zinc, and calcium balance, along with a change in my diet, my last MRI showed that the tumor was now in a necrotic state. What's ironic is that my doctor at Emory in Atlanta dropped me as a patient because I refused to have the surgery. I truly believe there's enough data to seriously consider taking more vitamin D, along with the cofactors, to potentially shrink fibroids. However, with all the fear around vitamin D toxicity, it's important to get all the details, especially regarding the scare about high levels of vitamin D. Thanks for watching. If you liked the video, leave a comment below, and do not forget to subscribe to the channel. See you in the next video.